And we begin our newscast with late-breaking news coming into the newsroom. City officials now confirming the first COVID-19 death in Bexar County.
Yeah, that patient, a woman in her 80s with a history of underlying health issues. She was being treated at BAMC, and we're told she died yesterday. Mayor Ron Nierenberg releasing a statement today, writing in part, "Today's tragic development illustrates the importance of the aggressive steps we are taking to thwart the spread of COVID-19. Stay home unless you need to go out. Follow the health experts' guidelines."
And this information comes as the number of total cases in San Antonio climbs to 45. Of those 45 cases, 26 are travel related. 10 community spread, 2 still under investigation, and now this first death. We are also now learning that Atascosa County has its first 2 confirmed cases.
And just a few hours ago, Texas Governor Greg Abbott issued 2 new executive orders in an effort to better combat the coronavirus pandemic.
Those orders are a part of his plan to help hospitals increase the number of beds, staff, and protective equipment. Our Japhanie Gray joins us now from the newsroom to explain what these executive orders mean. Japhanie?
Yes, guys, the first new executive order, Governor Greg Abbott is ordering that all licensed healthcare professionals and facilities postpone all medical procedures and surgeries that are not medically necessary. The second executive order is that he is suspending certain regulations that would allow 2 beds in 1 hospital room. Now, these orders come just days after he passed an executive order limiting gatherings to 10 people or less and closing all bars and dine-in restaurants. All at the start of this press conference, Abbott listed the number of tests given to Texans, those who have tested positive and those who have died. According to State Department of Health Services, 334 Texans have tested positive across 43 counties. That is less than 10% of people who have been tested, which is around 8,700. So far, there have been a total of 7 deaths. Though there is a limited personal protection gear and testing equipment, Governor Abbott says he's waiving regulations to address a potential shortage of nurses during this pandemic.
This will allow temporary permit extensions to practice for graduate nurses and graduate vocational nurses who have yet to take the nursing licensing exam. It will allow nurses with inactive licenses or retired nurses to reactivate their licenses.
Governor Abbott also added that he's activating the National Guard during this time to help local hospitals, whether it be with drive-through testing sites, setting up medical tents, or standing up vacated hospital facilities. Now, I do want to note that Governor Abbott did address rumors circulating about a statewide lockdown. He says that is not the case, as only 43 out of the 254 counties have been impacted by COVID-19. He did say, however, penalties are in place should some fail to follow the executive orders. That could mean a $1,000 fine, jail time up to 180 days, or a mandatory quarantine order. Tim, Courtney?
Thank you, Japhanie. Remember, there is a drive-through testing site at the Freeman Coliseum for first responders, healthcare workers, and via bus drivers. As for the public, as of right now, you must have doctor's orders to be tested. So if you don't have those orders, don't even show up to the testing site.
And on our website right now, we have an interactive map with live updates on those confirmed cases in Texas by county. The map is color-coded to show which counties have a high number of cases. Bexar County officials issuing new initiatives to ensure their own employees' safety starting tomorrow and lasting for the next 2 weeks. Employers must report to work who are asked to check their temperature prior to coming in. All non-essential travel is canceled. All in-person county public committee meetings are either postponed or to be done electronically. That's except for Bexar County Commissioner's Court. Social distancing is encouraged and hand sanitizer will be placed at every entrance.
And you were watching it live just a few minutes ago. President Donald Trump holding his daily briefing on the coronavirus pandemic. President Trump taking time to thank those working hard to combat the outbreak.
We're profoundly grateful to our nation's state and local leaders, doctors, nurses, law enforcement, and first responders who are waging this battle on the ground.
President Trump also spoke about Senator Rand Paul, who is the first senator to report a positive test result for COVID-19. The senator says he was only tested out of an abundance of caution after extensive travel and events. He is now under quarantine.
As lawmakers in Washington are working on an economic relief bill, governors and other officials are working on meeting the growing demand for personal protective equipment for healthcare workers. Here's ABC's Zachary Quiche with the latest.
Talks resumed on Capitol Hill today as lawmakers work to put together a $1.4 trillion package to provide economic relief amid the novel coronavirus pandemic.
This is about direct assistance to the American people and to small businesses, to hospitals and others who are in need, because we in government at all levels, in order to deal with this pandemic, have basically shut the economy down.
With at least 6 states ordering all non-essential workers to stay home and many businesses shuttering, millions of Americans are now out of work. New Jersey's governor says his state, along with New York, Connecticut, and Pennsylvania, need $100 billion in direct cash assistance to fight the pandemic, as well as personal protective equipment for medical professionals.
We've had a big ask into the strategic stockpile in the White House. They've given us a fraction of our ask.
In addition to the economic hardships, the outbreak is taking its toll on the nation's healthcare system.
We are the United States of America. We should not have to be in a position where we have people die simply because we don't have adequate supplies or adequate beds or adequate workforce.
The White House Coronavirus Task Force says it's working with the Department of Health and Human Services to get much-needed personal protective equipment to hospitals across the country.
HHS is completing a $500 million order of N95 masks.
Businesses are being asked to donate any equipment they have. New York City's health department is limiting COVID-19 testing to hospitalized patients only in an effort to preserve not only tests, but also protective equipment for doctors. New York's governor says his state is working to slow the rate at which the virus is spreading.
We have 53,000 hospital beds available. Right now, the curve suggests we could need 110,000 hospital beds, and that is an obvious problem.
Zachary Quiche, ABC News, New York.
And as always, we have more coronavirus coverage online on our website. We have a map of where students can find curbside meals while school is closed, information on the upcoming blood drive by the South Texas Blood and Tissue Center, and answers to all your questions submitted to SAQ, and so much more. Just head to KSAT.com and click on the coronavirus tab on the homepage.